Okay, Dr. Chong.
You can hear me now, right?
Yeah, definitely. Okay, Dr. Chong, today we have a few attendees from Singapore. We have from Japan, Minako-san is already on. And then we have from Malaysia, we have from Italy, we have from Singapore. And then, so everybody say handshake, say hi, hello. Okay, all right, what is more important thing is, it is an honor today that we have arranged for Dr. Chong to share with us how a person actually develop high blood pressure. This is a very, very interesting topic for most people because most of us have this issue actually when it comes to aging. All right, so Dr. Chong, are you ready? If you are ready, I'm going to make you a host. Okay, and we are from Hong Kong as well, Dr. Chong. Also, we are from Hong Kong. 所以咧，陣間有一啲問題咧 more or less, if they were to ask in Cantonese, then we will try to translate and coordinate at the same time.
Hi, Marcus.
Hello, hi, Dr. Chong. Yeah,
hi, everybody.
Hello, everybody. Okay.
Hi, my name is Dr. Chong. I'm from Kuala Lumpur here. I feel very honored to be actually invited, to share some information on hyperpressure with you. Okay, and Marcus, from ASENTAR is the one sponsoring this event. Okay, and Marcus, shall we start now? Or?
Yes. Okay. Thank you, Dr. Chong, for a self-introduction. And then, most important thing is I would like every partners that is online now, the attendee, please take a paper and pen and then write down if you can later on if you have any questions. So the whole session will be in English. If you have any question, please do write it down. Okay. Allow me to introduce actually Dr. Chong. Is graduated from Trinity College since 1996. He has been a medical practitioner for the past 25 years. And most importantly, he's also an aesthetic physician specializing in anti-aging medicine since 2017. Okay, without further ado, let's start and then let's allow Dr. Chong to kickstart in that sense. Thank you very much. Welcome, Dr. Chong. Yay, everybody clap. Clap. Yay.
Thank you okay, for the kind introduction.
Okay, good.
Okay, right. And today's topic, we're actually trying to talk about one of the chronic diseases that we actually get as we get older, okay? And the topic we are talking tonight would be high blood pressure, actually. And I'm sure a lot of people actually, do have somebody in the family having high blood pressure problems. And a lot of people, would like to know exactly what actually causes high blood pressure, okay? Blood pressure, what is blood pressure? Blood pressure is the amount of force that blood exerts on the walls of the arteries as it flows through them. When this pressure reaches certain levels, when it's high, it can lead to a serious condition causing a lot of health problems in our body there. Okay. I'm sure if anyone knows Chinese here, you can actually go through the Chinese thing. So Chinese explanation there. Blood pressure is normally actually, written in two readings, the one on top and the one on the bottom. The on top reading is what we call the systolic pressure, and the one on the bottom is the diastolic pressure. And both pressures are actually important. The last time, a lot of people think that the pressure is only important, the bottom not so, but actually both are actually important, okay? So any pressure, okay, over here we have broken down the pressure into different categories actually, okay? But for a person to be considered having really high blood pressure, which requires treatment, the pressure has to be at least 140 to 90. That means anybody having pressure of 140 systolic over 90 diastolic should be on medications. Anything between 120 to 140 on top and 80 to 90 on the bottom, we should do something about it, because this stage is what we call like a pre-hypertensive. That means that if you don't do anything about this thing, you are going to develop hyperpressure eventually. And it's a rule of thumb that the older you get, the higher the pressure goes. So we have to do something about this thing even before we reach the pressure on the high side. And the last thing is, if your pressure is so uncontrolled until the upper pressure is 180 and the bottom is 120 and above, this is what we consider as hypertensive crisis. That means that person has a chance of getting serious illnesses and things like heart attack, strokes, and things like that. And you have to consult your doctor immediately if your pressure is above this reading. Okay, let me tell you about why are we treating blood pressure. A lot of people might ask, a lot of people actually have high blood pressure without any symptoms. They don't have headaches, they have nothing. And when the doctor asks them, yes, you need to take pressure medicine because your pressure is high, then what is the reason? People ask you, what's the reason why? I don't feel anything. Why should I be taking hyperpressure medicine? The reason is hypertension is like a silent killer. It causes a lot of what we call, like a pressure-related problems. The three main problems that we are talking about hyperpressure is actually cardiovascular diseases like stroke, heart attacks, and kidney diseases. Okay, and these actually diseases can occur without you knowing any symptoms, without you knowing when this thing is going to happen, and it can just happen anytime, causing sudden death. Okay, other blood pressure-related problems will be vision loss. People can actually, start having, not to say like going blindness, into blindness immediately, but visual loss is one problem. Heart failure also, like people with repeated heart attacks, or even if there's no heart attacks, actually, the heart will become actually weaker and weaker over the days. And in one day, your heart is going to fail to function, and this is what we call the condition of heart failure. Okay. Sexual dysfunction also is another problem that actually which is related to hyperpressure. And this is not only related to pressure, because when people have hyperpressure, they tend to have other metabolic diseases like diabetes and high cholesterol. And together, hyperpressure, diabetes, and cholesterol can actually contribute to sexual dysfunction. You might like to ask, okay, what are the reasons or what are the causes people's pressure go up? Okay, and there are a multitude of reasons, why pressure goes up. We know that there are risk factors actually for hyperpressure to develop, and we do not know, why the pressure goes up, with age. Okay, the risk factors are normally I would divide them into two categories. The first category is something that we cannot change or we cannot do anything about. Okay, the number one factor is aging factor, as I've just mentioned earlier, and it's a rule of thumb, as someone gets older, the higher the pressure goes, okay? And the pressure is directly proportional to your age. So your pressure when you were 50 years old is always higher than the pressure when you're 20 years old, okay? The second factor that you can't do anything, you can't change, is actually family history. If you're born, to a family whereby your parents are hypertensive, your siblings are hypertensive, and a lot of people are hypertensive in your family there, the chances are you're going to be like one of them one day, okay? And you can do nothing about it because this is already in the genes, okay? The third one, okay, which I think that, which I know that nobody can change, is actually gender, okay? In general, male patients actually are more likely to develop hyperpressure than female people. And this one we do not know. It's just a male preponderance towards hyperpressure people, okay? And these are the factors, the risk factors for people to develop hyperpressure without our ability to change them. If you have these sort of things, your chances of getting hyperpressure is very high. The risk factors we cannot change, which are the gender, the age, and the family history. Okay, and now we go to the part whereby the risk factors which can be modified, that we can do something about. Okay, the number one will be obesity. Okay, it's a well-known fact that the more obese you are or the more overweight you are, the higher the chances of you developing hyperpressure. Okay, and you can certainly do something about it. Weight loss is one of the things that you should be aiming. The second will be actually physical inactivity. Okay, people actually who do not do much of a physical exercise or living sedentary lifestyle, they actually having higher chances of developing hyperpressure. Okay, so this is the physical inactivity. So doing more exercises are what we need to actually cut down the chances of hyperpressure. Another thing is smoking, actually. Smoking will definitely directly cause the pressure to go up, okay? And smoking actually doesn't only cause the pressure to go up directly. It actually, when you talk about people who smoke, they tend to be like people who are actually having more stress in their lives and they probably have more anxiety levels in their life or they can be depressed, whatever. So smoking, and hypertension actually quite related, because these people who are actually having stressful life and anxiety in their lives, they tend to actually, smoke more. So smoking can contribute to this hyperpressure. Okay. Alcohol intake also another one. People who drink excessive alcohol also will actually develop hyperpressure more easily. The same thing also applies to alcohol intake, because people who do take a lot of alcohol or who go for alcoholic abuse tend to have higher stress, in their lives and anxiety in their lives. And that will also cause them to develop hyperpressure. Poor diet, okay? there are many studies, that have been done, to actually confirm that, people who are taking high salt and high fat diet, in their everyday diet, actually will have a higher chances of developing hyperpressure. And the fat, that contributes the most to this hyperpressure thing is actually trans fat. So people who are taking a lot of trans fat actually, tend to develop this hyperpressure condition as well. And people with high cholesterol. And this thing, rather than being a direct cause, of hyperpressure, I would say that high cholesterol tends to be associated with hyperpressure. When a person has hyperpressure, okay, the cholesterol is normally, to be high. So we can actually make a conclusion that people who have high cholesterol tend to have hyperpressure. So it's more like a co-existing condition rather than one causing the other. Mental stress, as I mentioned earlier on, mental stress and also physical stress can cause actually your pressure to go up. Okay, mental stress are tension at work, inability to sleep, a lot of conflicts in the offices, relationship breakups. These are all the stresses. All these things will cause the pressure to go up. Physical stress also can do it. Physical stress are those like, you don't sleep well, jet lags, okay, you do not have adequate sleep, even though you're not that mentally stressed, but because you do not have enough sleep, insufficient rest, actually, that will cause the pressure to go up as well. So both physical and mental stress are actually factors for pressure to go up. And diabetes is another condition that, which is very much associated with hyperpressure. Okay, diabetes do not really cause hyperpressure directly, but it does have some effect in causing the pressure to go up. But the main thing is people with diabetes tend to get hyperpressure as a co-existing disease. So diabetes, people who are diabetics actually have higher chances of pressure. And both diabetes and hyperpressure actually will end you up with the same problem like heart problems, stroke problems, and talking about kidney diseases. And pregnancy. Pregnant women have a higher risk of developing hypertension than women of the same age who are not pregnant, actually. And pregnant ladies can actually develop very, very severe hyperpressure during pregnancy. These people will have a higher chance of developing hyperpressure later in life. That means that if a pregnant mother, develop hyperpressure during pregnancy, the chances of her becoming hypertensive later in life is much, much, much higher than other people who never had hyperpressure during their pregnancies. Okay, sleep apnea is another condition. Sleep apnea is actually a disorder whereby the person actually stops breathing during sleep, and this would actually contribute to the pressure going higher. As I said earlier on, a lot of people, they do have hyperpressure, but they do not know that they have it because hyperpressure do not always give people symptoms. So a lot of people actually having pressure without them knowing that the pressure is there. And that's the reason why we call this hyperpressure condition a silent killer. As all the, the complications I've told you earlier on. So if your pressure is high, but you don't know that the pressure is high, you will still get all those things that I mentioned earlier on, the heart attacks, the strokes, and the kidney problem, this sort of things, which can kill you eventually. So this is the, the hypertensive crisis I mentioned to you earlier on. Okay, when the pressure reaches 180 over 120 and beyond, this is considered as hypertensive crisis, which means that it's a medical emergency. So at this stage, the person normally develops some symptoms, which includes a headache, nausea, vomiting, giddiness, the vision becoming blurring, nose starts to bleed, the heart, like pumping actually quite fast and strong, and that person might develop some breathlessness because this hyper pressure can cause the heart to fail. When the heart is failing, the person, will experience difficulty in breathing.
Actually, up to this stage, I think everyone more or less understand how the entire hyperpressure is being formed and what are the factors that will actually constitute to hyperpressure. So the next question, actually, just now you have shown is, would the above factors that you have shared will also create a lot of free radical condition that leads to the body to have a hyperpressure? That means hyperpressure because of the factor, the fatty, the pregnancy and all that. But would that create a lot of free radical? That's why that leads to hyperpressure. This is actually what the question is about, actually, over here.
Yeah. There always actually this link between free radical conditions in the bodies, and hyperpressure. A lot of studies have been done regarding, the link between free radicals and hyperpressure. Yes, there's definitely a link, a very strong link between free radicals and hyperpressure.
So what is actually
a lot of those?
Yeah, correct. So if you go down, so what is actually free radical? To most people, they may not be able to understand what is actually free radical.
Okay. To tell you about or to explain about what free radicals are, let me go through a little bit about human physiology actually, Okay, can you see the picture? Can you all? Okay, we have a body, okay? We can break the body down into different systems, like the cardiovascular systems, the kidney systems, the gastrointestinal systems, that sort of things. And different systems actually have different organs, okay? And the organs also can be broken down into tissues, the group of cells, and then they also can be broken down into cells, individual cells. Inside the cells, there are a lot of molecules like proteins, like a lot of enzymes and things like that. And eventually, if you break all these things down to the minimal, most basic sort of like element, is what we call the atoms actually in the cells. Okay. Today we know that all these things are there. The bodies, the systems, the organs, the tissue, the cells, and the end of the things is actually atoms. Okay. What are actually free radicals? Okay. When you look at the structure of an atom, and this is a very stable atom. Why? Atom has got one nucleus in the middle, which is the center, is like the heart of the atom there. And again, it has a lot of electrons. These are electrons actually circulating around the atom. Actually, in a stable atom, which is very neutral, which is harmless to other people, the atom actually, has got paired electrons. They mean the electrons are actually, what do you call that? Occurring in even numbers, so they become very stable. Okay, what happened is, okay, this is like a healthy stable atom. You see all the electrons are paired. Okay, they're all in even numbers actually circulating around the nucleus. Okay, and free radical actually, is actually an atom, which has unpaired electron. Okay, and this free radical very very unstable. They are actually scavenging around. They will go around, trying to steal or trying to rob electrons from other tissues, so then they become stable. Okay, and in doing so, okay, when they actually rob, the electron from another tissue, that tissue becomes unstable or damaged.
So, Dr. Chong,
this is what we call damage done by free radicals. Yeah.
Okay, so Dr. Chong, what you are saying is a healthy electron, a healthy stable atom will actually have one pair of electrons. So when one of the electron is missing, they become like a single entity, and that becomes very unstable. Is that what you're trying to say?
Basically, that's
that's the
reason why they become unstable. Yeah.
So when it becomes unstable, they will go around hunting for other electrons to pair up again. Is that what you're trying to say?
Yes. So that they themselves become stable.
Okay. So by doing so, they are actually robbing. That means they are snatching electron from another pair, so that it will affect the other functionality. In that sense, it becomes not stable.
Yes.
Okay.
That's very true. So, and those things that these unstable like free radicals are actually hunting their electrons from are those like what we call the healthy cells in our bodies. So if they actually, just to give an example, if these free radicals actually is hunting electrons from collagen, collagen in our body, so it will make our collagen becomes damaged. So once the collagen loses the electrons, the collagens becomes actually like more unstable, and then they become more cross-linked. Because they are unstable, they will link with other collagen molecules to become hardened. That's the reason why as we get older, our skin gets hardened and thicker and less elastic because of the damage to the collagen. Okay, so this is what we call the free radical damage.
I see. So does that mean also by virtue of this instability in the collagen, or rather in the cells, in the atoms, so when that many cells and atoms are being unstable, the overall function of the body will be affected as well?
It will be greatly affected actually, but it doesn't happen over one night. It doesn't happen over 1 or 2 years actually, and this is what we call the chronic, aging problems. It actually happens more and more and more with age. So that's the reason why, the older you get, the less functional your kidneys become. The older you get, the more rigid and less elastic your your skin becomes. The older you get, the less functional your brain cells, you start losing your function. They can eventually go into Parkinson's disease and dementia as a result, because of the dying off of the healthy neurons in the brain.
I see. So having this situation with the atom unstable, what is actually causing the free radical to appear?
Yes, a very good question actually. Free radicals actually, there are two sources of free radicals actually. Okay, free radicals can be actually produced by our own body, and we actually every one of us produce free radicals on a daily basis every second. Okay, basically the cells that actually create a lot of free radicals are our mitochondria, which is one of the the structure inside our basic cells actually. And these free radicals which actually come out to destroy the mitochondria itself, and of course all the tissues that I've just mentioned to you earlier on. This is what you call the internal free radicals. Okay, this one you can't do nothing about. Your body will continue to do it because of our metabolic process.
Okay.
Other free radicals actually are from the outside, or what we call the external sources of free radicals. Okay. Let me show you the slide.
Okay, yeah. The external one.
These are the external sources of free radicals actually, Okay, what are they? The sunlight, ultraviolet light, something very common, like everybody, especially in this part of the country, in the tropical country, whereby sunlights are always there, okay? UV lights actually create a lot of free radicals and cause a lot of free radical damage to our skin. Okay, Of course, air pollution is another major factor, as now places are getting more industrialized, more factories, are actually being set up, and more actually pollution are being produced on a daily basis. Ionizing radiation, okay, sunlight also gives you ionizing radiation. Even people like from any factory that actually, using radiation can cause the what do you call that? The free radicals, which damage our DNA, our cells in the body there. Smoking is another very strong, a factor in creating free radicals. Okay, so you look at 100 people who are smoking, all 100 people will be having free radical damage. There's no exception for that. Okay, other things are metabolism. The things I just told you about. This is something inside our body, and also inflammation inside the body. Inflammation is another process actually whereby our body actually produces free radicals and damage to the cells. Okay, you can see they've listed some of them, like even fried food also, alcohol also, cigarette smoking, or the insecticides and pollution, all these things have free radicals.
Okay, so Dr. Chong, now that we are living in this 21st century in this world, how do we actually reverse this condition to actually remove the free radical or reverse the free radical condition actually? How do we go about doing it actually?
Okay. Let me show you this diagram. Okay. This is a stable model, just like our normal healthy cells in the body there. Okay, and free radicals is unstable, and free radicals are actually scavenging and hunting electrons, from our healthy cells. Okay, but we need to stop it. We need to prevent this thing from happening. So because we want our cells to continue to be healthy, we do not want our cells to be damaged. Okay, but these free radicals are hungry. So how do we neutralize these free radicals or get rid of these free radicals? Is by giving our body antioxidants. Okay, antioxidant means they are actually a molecule or atom which will donate an electron to the free radical, making the free radical harmless. Do you understand? Can you actually follow?
Okay. So basically, by putting in antioxidant into the body, we are able to put the free electrons back into the damaged one, unstable one, to make them stable again.
Exactly. Actually,
Okay.
we need to neutralize. What we are trying to do here is to neutralize the free radical so that they become unharmful. They're not harmful anymore. Okay. In order to actually to make them not harmful to our cells, we need to actually put in antioxidants from into our body to actually neutralize them. Okay.
I see.
Also, free radicals, as I said earlier on, there are two major sources. Our own body produces. Okay. And it can be from outside. The same thing also, antioxidants, we have, our own bodies have an endogenous. That means that we bodies have a defense system against the free radicals in our bodies itself, okay? Our body actually, produce some antioxidants, But when the antioxidant is being produced, cannot beat the free radicals. As I told you, there's so many other things that's causing the free radicals, the sunlight, chronic exposure of sunlight, chronic actually like exposure to pollutants, or eating highly, like a deep fried trans fats, fatty food, cigarette smoking. All these things are generating a lot of free radicals, which our body cannot handle anymore. So when our body antioxidant is overwhelmed, a lot of damage will happen because there's nothing to actually, make the free radicals, unharmful. So whatever that is remaining there will start to attack our own body. So what we need to do is we need to have an external source of antioxidant to try to neutralize the free radicals. Can you understand? Can you get?
Okay, Dr. Chong. Let me see whether I can understand from your explanation. That means we do have own production of free radical plus external free radical to affect us. So it's a double condition that is forcing us to create free radical, and yet our body is able to create antioxidant, but is not able to cope with the explosiveness, extra excessive creation of the free radical. So we need to input external antioxidant to solve this problem.
Exactly. The effect, of the damage. Actually, a lot of studies have been done actually to see the damages, being caused by actually free radical damage. They're called 自由基, the free radicals actually. These are all what we call age-related chronic diseases. Like hardening of our arteries, cancers, inflammatory condition of arthritis problems, asthma, diabetes, dementia, as I mentioned earlier on, and all the degenerative diseases, like thickening of the skin, inflammation of the skin, actually, the bones are actually getting less strong. All these things are caused by what we call free radicals, which generate chronic diseases like this, actually.
So, if you want to do something about it, how do we solve this? There will be inputting of external antioxidant. Is that what you're trying to say? So we consume food that give us or supplement that give us antioxidant, right? That's what you're trying to say. Okay.
Exactly. I am actually, an anti-aging doctor, and I always actually, recommend my patient to take antioxidants. It's a supplementary antioxidants, because all of them, not everybody, in this world, can live in a very 100% healthy condition. Okay, if you can do that, then maybe your own, antioxidant, production in your own body can deal with the free radicals. But a lot of us can't, it's beyond our control to do that. The way we don't sleep well, the stress we are undergoing, the cigarette smoking, the alcohol consumption, the bad food diets, that we are going through every day, the very bad sun exposure, every day, cause a lot of free radicals, whereby our own system cannot handle anymore. So we definitely need an antioxidant. To actually help our body to fight the aging process.
Okay, good. So, Doctor, thank you very much Dr. Chong, thank you very much up to this stage. Sure. So, Dr. Chong, basically what happened here is, I would like to ask, so based on your understanding, because we have sent you our ingredients and we have sent you the clinical study, there's this particular ingredient called astaxanthin. Okay, there's this particular ingredient called astaxanthin that the antioxidant level is at this point the highest compared to other cell food. What can you share about astaxanthin that you have known based on the clinical studies that you have read?
Okay. Actually, astaxanthin has got a lot. It's a very potent, antioxidant. It has been, recognized as one of the strongest and most potent antioxidants available in the world. Okay, so a study done by I can't remember which college it was by one of the American college. They compared astaxanthin to any other antioxidants. There are many other antioxidants like grapeseed extract, vitamin E, CoQ10. They are all antioxidants basically. And when they do, vitamin C also another antioxidant. So when they do a comparison between this astaxanthin, antioxidant, which is actually derives from, marine creatures and, stuff. Okay, they found that, astaxanthin has 8,000 times more antioxidant ability or capability compared to vitamin C. And other factors are, it's 800 times more potent than CoQ10 when it comes to antioxidation properties. There are many others, green tea extracts, green tea has a lot of antioxidants, and astaxanthin is 550 times actually higher than the green tea extracts.
I see. Okay. Now at
So
this,
it's a very potent antioxidant.
so basically, instead of eating CoQ10 or vitamin C or any other stuff, all we need to do just take astaxanthin. We are able to actually compare. We are able to compensate with others already. Actually, in that sense, correct. Just take one instead of so many,
yes.
because
You know,
in the market we
actually,
have many
to answer
people.
the question
Yeah,
is
correct, correct. Yeah, because many people tend to compare. Say that I take CoQ10, I take grapeseed extract, and then I take vitamin E. So instead, what you are saying is actually by taking astaxanthin alone, you can actually cover the rest already. Would you say because of the comparison based on the clinical studies?
to answer this question, actually, it depends on, why are we taking, astaxanthin? Okay. In order to get a good, antioxidant, astaxanthin would be my first choice.
I see. Okay.
Effect, but we cannot say that astaxanthin is a replacement for everything. But definitely, it's a very, very good option, to prevent, for us to actually stop the aging process, or the chronic organ damage. Okay, but we can't say that you take astaxanthin alone is enough, because there are other things like coenzyme Q10, vitamin C, vitamin E. You need to take them as well, because you need them for other purposes. We don't do that because vitamin C also, we need it to, for collagen synthesis. We need vitamin C for like our immune system's ability, to perform better.
Okay.
So, there are a lot of other supplements also, I would say that we need to, to consider, but when it comes to antioxidants, and when it comes to like prevention or combating, the chronic, aging process, the chronic damage by free radicals, to our bodies, antioxidants, like from astaxanthin would be my first choice. And the good thing about antioxidant is you cannot overdose yourself with antioxidants.
Wow, Dr. Chong, this is the next question. Actually, I have last 3 questions to ask, but the next question is, are there any side effects to taking high level of antioxidant astaxanthin? Now you are answering already. Many people concerned, will there be any side effect, if taking so much?
You see, one good thing about antioxidant, that so far we have not documented any side effects of, like overdosing, oneself with antioxidant. Okay. Antioxidant, one good thing about antioxidants by astaxanthin is actually part of it is water soluble and part of it is fat soluble. You see, the normal antioxidants, okay, like vitamin C is only a fat soluble antioxidant. So it does no advantage, for free radical damages in people, in the fatty layer. Okay, it's only in the non-fatty layer. And vitamin C is a fat-soluble antioxidant, so it only does the control the damage in fatty layers, but not the water the water-based layer. But astaxanthin is actually both together in one molecule, so it actually penetrates both the fatty and the non-fatty, the water-soluble areas. So it actually gives you a much more what we call wide spectrum of antioxidation.
That means it's more efficient in that sense in solving the problem.
Exactly.
I see.
It does the antioxidation in a more effective and efficient way.
Okay. So the next question, second question. If let's, for example, I take astaxanthin and take antioxidant, how do we know it will reach a stage where I can start reducing on my hypertension medication? How do we know?
Yeah. One thing that, when we talk about antioxidants, okay, we cannot say that by taking antioxidant, you can stop all other medications that you are taking now. I can stop my diabetes medicine, I can stop my Parkinson's disease medicine, I can stop my pressure medicine. You don't do that actually. You go on antioxidants. You take antioxidants as your regular supplements, health supplements, okay? So when the antioxidants, start helping your condition, okay, sometimes you can see your pressure, your diabetes, your dementia, your even Parkinson's diseases, things like that actually will become less and less severe. And you might actually, start having to reduce the medications you are taking. So for pressure, you just have to continue to measure your pressure. So if your pressure starts to go down, okay, we will just have to stop the medicine. I've seen people, after doing correcting the lifestyle of hyperpressure, taking good care of themselves, going on antioxidants, going on supplements, going on healthy diets, I eventually have to stop the hyperpressure medicine for them.
So what you are saying, doctor, based on what I'm hearing, basically everyone who start taking astaxanthin and on antioxidant, after a while when they do their own checking on their measurement, or rather they can go back to the doctor and do a thorough checking, let the doctor would have to decide whether they should reduce the medication or not. That's what you are trying to say, right? It is better that way, correct?
Yes,
It's more accurate, right?
Exactly.
Yeah. Okay.
Don't get me wrong, please do not start to tell your doctor that, doctor, because Dr. Chong told me to take antioxidants, so I will stop coming to see you, I will stop my pressure medicine. Don't do that, actually. You speak to your doctor. I don't want to be blame and held responsible for that. But what I'm trying to actually, get the message across here is antioxidants help a lot of our aging process, which includes hyperpressure. Other things like diabetes, other things, a lot of other things, which is already age-related, A lot of these things we do not know. We did not know actually 50 years ago. We didn't know 20 years ago, We just say, okay, your pressure is high. Doctor, let's say, go on medication, start medicine, control your pressure. But now we know exactly, we know more about how this thing actually come about. We know how someone, why someone develop hyperpressure. And then we know that, oxidation process is one of the major aging process in causing this sort of condition to happen. So why not tackle this sort of the root of the problem rather than just treating the pressure being high?
Yes, thank you very much. That leads to our last point, closing question will be, what is your best advice on this saying, say, prevention is better than cure? Because not many doctors talk about it, but because I heard you mention before throughout the whole few sessions that we have met together. So what's your best advice on this saying, as in prevention is better than cure?
This is something that, cannot be, cannot be denied, actually, and that's the reason why we nowadays actually doing what we call anti-aging medicine. We are doing preventive medicine. We are doing something like how do you say? You're trying to actually prevent somebody from getting sick rather than trying to create something to help people after they've got sick. Actually, of course, we're not saints, we are not God. We cannot do anything. By taking antioxidants and supplements, do not mean that you will never fall sick in your life. Aging process cannot be reversed. It cannot be controlled. Yes, you will start getting aging, and you start getting aged and getting more and more, aging. More of these diseases will come. But by taking the antioxidants, you can actually slow down. I won't use the word reverse your aging, but you maybe can come to the, to the extent of reversing your aging, to a certain age. Maybe that means that, if you don't do anything, by the age of 50 years old, you can already look 60 years old, okay? By doing something like taking antioxidants to slow down the aging process, so when you're 50 years old, you might still look 40.
Okay.
Prevention of this aging thing, is something that we all need to follow and start doing, actually, before things are too late.
Okay, having this last question, there are people who always compare, taking antioxidant supplement, they want to save money and not to take antioxidant. But is that true that at the end they can save a lot of money?
This is something like, okay, like how to put it? Okay, I would not want to save money, for something that I can actually prevent myself from using.
Okay.
I do not want to save money for a heart bypass surgery. Okay, I want to, use my money now to prevent my heart from getting blocked, from getting a heart attack or something like that, actually. Doesn't that make sense?
Yes, it absolutely makes sense. So what you are saying is, instead of saving money now, at the end you got to pay medical bill for all the medical situation.
Yeah. Just like you need to be careful with your car, to make sure that you maintain your car, you send your car for regular servicing and maintenance checks, and you be careful when you come to driving the car. Okay, it should be that way. Rather than just, do not do anything, in taking care of the car. You do not send your car for maintenance services and servicing, and then just drive recklessly, and then one day you get involved in an accident. Okay, or because I've saved money enough to, to repair my car after that. Because it doesn't make sense that way.
I absolutely agree.
It's always, good to actually maintain something, rather than, repairing something at the end.
Yes. So that's the most important essence in about prevention is better than cure. Don't save money at the end so that you have money to repair. Don't save money on prevention, on health, rather than pay medical bill trying to repair whatever that's damaged.
Okay, so that's the essence of anti-aging. Anti-aging is not about, bringing you back into, from 50 into 20 years old, Anti-aging basically, is a bit misleading. Anti-aging basically means slowing down the aging process. as I said, nobody can actually stop aging at all. Nobody can live until the age of 200 years old. Okay, we will age, but we should age in a very healthy, correct, and gracious way.
Thank you. That means age with gracefulness rather than going through medical situation. I see. Okay.
Exactly. Yeah.
Okay, tonight, this is an awesome evening. Thank you very much. Thank you very much, Dr. Chong, for sharing with us. Okay, I think this is a very, very enlightening and information transfer. At least now everybody know what is going on, what is actually anti-aging. So for those that join in late, please feel free. We will do this into a recording session. Please feel free to type in the questions and ask the questions after this session when we go offline. And then all the attendees as earlier, we can actually send out all the links so that everyone can actually revision and then go through again. Okay. So without further ado, I would like to more or less, because the time is almost up with Dr. Chong. So after this, individually, please go back to your own chat group. Feel free to ask as many questions as possible. With this, I would like to thank you, everyone. Thank you, everyone, for this session. And then thank you, Dr. Chong. Everybody, let's have a clap. Thank you, Dr. Chong. Yes, everybody, those who are showing video.
Thank you.
Thank you, Dr. Chong. So for
I hope
this,
I give you some insightful information. Yeah.
Okay, thank you very much. Thank you, everyone, for joining this wonderful session. With this, I'll see you all next week.